Gathering today in Sydney, families and loved ones of those who died in Anglicare's Newmarch House aged care facility are looking for answers on day one of a 3-week inquest.
Any family deserves to know about their loved one. That's all we want. We want answers. We just want to know.
Their heartache began on April 11, 2020.
6 staff and 4 residents are now positive after an employee
went to work sick.
Her only sign, a mild, scratchy throat.
People's lives are at stake. If you have any doubt about your health and fitness to attend work, don't go.
By the end of the first week, 87% of the workforce was furloughed, and it became increasingly difficult to find replacement staff, leading to catastrophic results.
This disease is just going wild in there. It's just rabid.
There's a lot of people in there that are in their last week of their life, for sure.
It's upsetting. It's family members, and I don't want to be one of them. You just can't help but feel that they're all going to be lost. That you can't help but feel that.
Families became increasingly desperate as time went on, with critical staff shortages leading to a communication breakdown.
We haven't had calls from a doctor. I haven't spoken to one doctor except right at the beginning.
18 days after the disease was first detected, 12 people had died. By June 2020, 71 had contracted the virus and 19 had passed away.
We told her we were all here, some of us outside the door, and that we all loved her and we would miss her.
A report into the tragedy found the facility couldn't have predicted the outbreak's speed, but it listed a series of failures, including a lack of proper infection control and no clear chain of command.
They should have asked earlier. They should have been screaming loudly to anybody who'd listened that they needed help, that things were out of control.
Newmarch is just one of more than 217 aged care homes hit during our first COVID peak, which claimed the lives of 678 of our elderly. So as Australia faces its next big Omicron wave, what can we learn from the Newmarch disaster?
Anthony Bowe has a relative still living in Newmarch, but for legal reasons relating to the inquest, we can't give more details than that. But Anthony joins us now. Anthony, take us back to that time. Why did things go so wrong at Newmarch?
Initially, Anglicare told the government they had a world's best practice level of readiness should there be an outbreak, and obviously on day one they were short of PPE, so there was a breakdown to start with, then communications issues, staffing, then they brought in people that weren't familiar with the setup. They had to do hand notes because they weren't familiar with the iCare system that was used in that aged care facility, so there was problems abound, and hospital and home just was a disaster.
So what did the inquest hear today that piqued your interest?
They said they're going to delve deeper into 2 major issues, whether hospital and the home was appropriate, whether the advanced care plan was fully explained to people so they can make an informed decision about leaving their loved one in aged care to be treated.
Anthony, your relative is still in Newmarch. Why did you decide to leave your relative in there?
There's not much options. She's happy there. We'd rather focus on trying to get her the best possible care. And I mean, are you taking her to somewhere any better? You know, the sector itself is a disgrace. So, you know, are you going to take her anywhere better than there?
Anthony, how is your relative holding up right now?
In lockdown again, there's at the moment there's 15 to 19 cases in there. It's a day-by-day process. The only difference this time is they have antivirals and they have a plan to fast-track that response should your loved one get COVID.
And given what we're hearing about how big this wave could be and your experiences in the past, I know different situations with antivirals, etc., but how confident are you in the processes that are there and the safety of your relative?
Well, it's a lot of unknown, really. I mean, there's so many more cases now because the reproductive rate's so high, 8.3, that means it's going to spread like wildfire. So if they haven't got the systems in place in aged care, this could be horrible, because once they get to needing acute care, once their lungs are compromised, they won't be given a hospital bed because the hospitals will be full, so they'll be deprioritised like before. And as you can see, the aged care system is not set up to deal with, intensive care type patients or high dependency patients.
Well, Anthony, all the best with everything, and we appreciate your time tonight.
Thanks very much.
You really feel for someone like Anthony. I mean, 2020 seems like so long ago, and that all happened like in the dim, dark past, but those families are still going through the trauma. And now we're going to go through this again. I mean, it is in aged care again, COVID. Yes, we have vaccination and antivirals, but who knows what the long term is going to be for people in these places.
We can only assume and hope they've learned a lot, because that was at the very start of the pandemic,
where
I can imagine, and the inquiries saying, a lot of them would have no idea what to do, how to do it.
The staffing issues still exist. They don't have enough staff in aged care.
Definitely true.